for joining this webinar today, where we'll be talking about building a mobile strategy, and talking specifically about secure, private, and compliant and efficient workflows. My name's Andy Wilcox. I'm the Senior Product Marketing Manager for our international markets here at Imprivata, and I'm joined today by two of my colleagues, James and Claire. James, would you like to introduce yourself?
Yeah, thanks, Andy. Hi, everybody. So my name is James King. I'm a solutions engineer for Imprivata. I focus specifically around our mobility products, so Imprivata mobile device access and Imprivata ground control, which I'll be talking about today.
And Claire?
And good afternoon, everybody. My name is Claire Riley, and I'm the Director of Clinical Operations here at Imprivata. With many years of emergency room, or accident and emergency, I should say, clinical experience, which is why mobility is very near and dear to me, and driving the efficiencies which leads to adoption for our end users. And I'm actually based in the US.
Great, thank you both. So looking forward to the discussion today. So James, if you want to pop the slide deck up.
Yep.
And let's just go through what we'll be talking about today, just touch on the agenda.
Okay. Okay,
great.
So the agenda there.
Yeah, fantastic. Thanks, James. So first of all, I'm going to do a quick introduction, talk a little bit about some of the challenges of technology adoption, which I think is particularly important as, mobile is still a little bit of an emerging technology in the clinical workspace. So we'll talk a little bit about that. Then I'm going to hand over to James, who's going to touch on some of the workflows that exist around, firstly, Android devices and how Imprivata mobile device access addresses that, and then move on to the iOS devices and how our ground control solution supports that, and then finally finish on a little bit on what's new within our technology platform. And Claire's going to be on hand and kind of jump in at various points to just give that clinical perspective. And that probably nice segue into talking a little bit about that challenges of adoption, and particularly around the mobile space, and why that can be such an issue for clinicians. And I think really, this slide really boils it down from the late great Steve Jobs. Is clinicians at the front line just want something that works. They just want to pick something up, be able to use it, because they want to focus very specifically on patient care. And if technology doesn't just work, then it's going to be a burden to their clinical practice, to their clinical workflow, and consequently stand less chance of being adopted by them. So if we go to the next slide, James. So some of those key challenges that exist with adoption. Well, firstly, lack of shared ownership. So often we see IT projects where it's entirely the IT team that are focused on purchasing, implementing, delivering the technology, and there's no clinical engagement. And where we see success with adoption is where clinical is embedded in that whole process from the very beginning, that they have that engagement and they really feel like they own the product, and they've had that voice in its introduction. And we've got some really good examples of that. Second is solution mastery. Training is something that isn't a do once and forget about it. It's an ongoing education of how to use the technology, how to make the most out of technology, and more importantly, kind of the values of how it brings benefit to ultimately patient care. And then finally, the third pillar of this, and really the crux of what we're going to talk about today, is that the kind of infrastructure and platforms. And if users have a really poor interaction and experience with the technology they're using, then firstly, it detracts from their usability, and then ultimately really kind of affects that ability for the technology to be adopted. If we go to the next slide. And as we look at the healthcare, the complexity of that healthcare environment and the landscape that we exist in, 15 years ago, it was all thick clients inside the four walls of the hospital, a small number of users, accessing data on Windows computers, and very, very simple, really. But over that, that intervening period, there's been a rapid expansion of, firstly, the number of users that need access to clinical systems, clinical data, from locums and non-clinical staff, contractors, and even patients now are interacting with data. And the locations that they do that from are much more expanded. So we've gone into remote clinics, out on the road, in patients' homes. And the consequence of that is that actually the devices that we facilitate that access on have expanded equally as rapidly. So we've moved beyond that fit client desktop into, certainly within the hospital, things like thin and zero clients. And especially when we're talking about being more efficient at the bedside or out on the road, mobile devices, which is really what we're going to focus on today. And that expansion of devices has necessitated an expansion of the applications that we use as well. And all of these devices and applications require some kind of identity to access. So we can't just give people carte blanche access to the devices and the application. It doesn't make sense to do that, and it's not secure and it's not good governance. And if we go to the next slide, James, that's where the looking at digital identity in a kind of unified manner across the whole organization is vastly important, and it's something that we at Imprivata care very passionately about. And there are many different areas that identity touches within the organization, from front-end authentication and access through to things like authorization, so what users have access to what data, when, where, how and why, through identity management, so where do we store identities, how do we facilitate access to new users, to users that are moving within the organization, and how do we remove access when they're leaving, right through to the very high-end governance and administration. So what national regulation and legislation do we have to be compliant with? How are we auditing and feeding that compliance? And if we go to the next slide, today we're specifically going to be focusing on mobile device access. So the challenges that exist within shared mobile devices and the applications that exist on them, how we grant access to those devices, manage them, and also audit and monitor what's going on them. So at this point, I'm going to hand over to James if we go to the next slide, and he's going to dig into that in a little bit more detail, talk about how we can unlock mobile success, drive adoption, and make clinicians really productive and mobile beneficial at the front line. James, over to you.
Thank you, Andy. So before I dive into the workflows that I'm going to talk through today, I just want to explain that we've got two different types of shared device mobile products. So we've got Imprivata's mobile device access, which is available on the Android platform. And then we've got Imprivata Ground Control, which is available on iOS and now Android, which I'll talk about more shortly. But really what I want to talk about is the mobile products that we have. They're not there to compete with or replace an existing MDM such as Intune or Workspace ONE. They're really designed to fill in the gaps where that MDM falls short in providing a workflow that is secure, efficient, that has user identity and ease of access into clinical applications. So the first workflow I'm going to talk about is mobile device access, which is available on the Android platform. So before I talk about the workflow with mobile device access, so we're going to move from left to right here, starting with number 1 there on the left. Now, this device has been configured by an administrator with security, so it has a PIN on the device, and it also has the applications deployed to that device so that the end user can use the correct applications that they need to. So the first step here is that the end user will pick up a device and they will unlock that device with the PIN. So they'll type in 1234. That's great. They're now into the device, so they can move on to step 2, where they can now open the application that they want to use. When they open that application, they need to recognize, they may potentially be logged in as somebody else. So they need to recognize and find out how to log out of that application. And then they need to log in with their credentials. So they're logged in as the correct account. So they put their username in, they type their password, and now they're logged in as the correct user, which is fine. They can now start using that application. But now on step 3 is that when that end user has now finished with that device, because it's a shared device, they need to make sure that they digitally desanitize that device themselves. So they need to make sure they log out of all the different applications that they were logged into. They may have had some web applications that they were logged into, so they need to go in and make sure that they log out of them. They need to make sure that they go in and clear their history, clear the cache, so that they remove all that personal information that belongs to them, so that when the next user comes along, that device is then fresh, ready for that next user. So what are the concerns here? The first concern is really around that PIN. So the administrator has configured a PIN on the device, so that 1234, but it's not a secure PIN, right? Because it's 1234. The reason that the administrator has set the device to 1234 is because they're going to have to set a PIN that is the same on every single device, and they're going to have to set a PIN that everyone's going to remember. So that has to be 1234, right? Because if you had a different PIN on every single device, nobody would know how to get into the device. The second concern here is around how long it takes to actually get logged into the applications that the end user needs to use. Also, the end user needs to recognize, they may potentially be logged in as somebody else, right? So they need to log in and go into the settings, make sure they know how to log out of that application, and then log in with the full username and password. And then the last concern is around that workload on the end user of having to go into each application, log out, clear that browsing history, clear that browsing data, etc., so that the device is fresh, ready for the next user.
Yeah, so Claire, at this point, I'd just love you to chime in a little bit on, how those challenges manifest themselves for you as a clinician at the front line.
Well, the first one, thank you, Andy. The first one is that James talked to the PIN number 1234. That's assuming that we create a PIN and put a PIN onto the device. And really what I'm looking for as the end user is to pick up that device. It's charged. It has all the applications on it that I need, primarily, obviously, communication, my EMR, if that's an integrated option, and then taking it back and returning it to a charger so that my colleague can take that device from me. And it really does need to be efficient. We don't need any more technology getting in our way. Technology needs to enhance us in the healthcare sector.
Thank you, Claire. So now moving on to mobile device access workflow. So again, moving from left to right. Now, the first step here is that rather than having a PIN on the device, what we do is we have a lock screen. And the way that end users would then unlock that device is by simply getting their proximity badge and tapping it onto the back of the device. And then the Imprivata software will then recognize if that user has valid credentials. If they have valid credentials, then we will allow them access into the device. So they'll move into step 2. So they tap their badge onto the back of the device. They're authenticated. We recognize them. We know that they're a valid user, and now they move into step 2. So step 2 is now that end user can open the application that they want to. And now this will happen quite quickly. But what you'll see here is because we have the identity of the user, we know who the user is through the badge tap, we can automatically populate the credentials for the end user so that they don't have to type in those credentials. We handle that for them. And the way that we do that is because we know who that user is through the identity, through them badge tapping onto that device. Now, once the end user is finished with that device, all they have to do is tap their badge again onto the back of the device to lock it, or they can give that device to another user and they can simply get their badge and tap their badge onto the back of the device. So moving to step 3 now, a new user will tap their badge onto the back of the device. And now what we're doing, the clever part of this is behind the scenes, we're taking that workload off the end user and we're handling that digital desanitizing of that device for the end user, so that now when the next user logs in, they are logged in with their identity and there's no concerns around potentially being logged in as the wrong account.
And that is the ideal workflow, James. When I talked to you earlier, that inefficiency for me to pick up the device, because let's be honest, we're not teaching anybody how to use a mobile device. Everybody's using them. What we do want is that efficiency on that shared device and returning it, keeping it efficient for me and then equally as efficient for my colleague.
Exactly, exactly. So the key things of what we're actually solving here, right? We're removing that insecure pin, that 1234. We're replacing it with a lock screen so that users can easily get into the device by simply just tapping their badge onto the back of the device. We're then providing that single sign-on into the application, so we automatically populate the user's credentials. We know who they are through the identity, through the badge tap, and then we take that workload off the end user of having to manually themselves desanitize that device ready for the next user. Now, the other great thing that we have is the reporting capabilities. So an MDM such as Workspace ONE or Intune will give you information on when a device was last online or connected, but it won't necessarily tell you who was using a device and when they were using it. So with Imprivata Mobile Device Access, we have those capabilities. So you know if you need to report, you know who was using a device and you know when they were using it. Now, I'm just going to play a video now to show you this device in a real world example. So County Durham and Darlington are using mobile device access for their Cerner application. And if I play this video now, you'll see this workflow in play. So the end user taps their badge. They then open their clinical application, which in this case is Cerner. Now, this will happen quite quickly again, but we've populated the user with the correct credentials. And then in a matter of seconds, really, we're now logged into the correct account and the correct user is logged in. There's no concerns around potentially being logged in as the wrong person. Now, what we're going to demonstrate now is that we will grab a proximity card of another user, we'll tap that badge onto the back of the device. And now, as we're logging in behind the scenes here, we're clearing that login information of that previous user. So now when the new user is logging in, they're going to be logged in with the correct identity. So when they open that same application, we're now going back to the login screen. We're automatically filling in those login credentials for that end user. And now they're logged in as the correct identity and they could start using that app in a matter of seconds. So now what I want to do is talk about ground control. So ground control is available for iOS and Android. And where ground control really excels is providing administrators with the asset tracking capabilities. We know that lost devices is a real issue for organizations. So we provide administrators with full visibility of where their assets are. And the ground control solution has a slightly different workflow. So devices sit in a docking station, which makes sure that the device is actually on charge, so that it's going to last a full shift, so that you're not having to, stop what you're doing, go and find a charger and put that device on charge. So before I get into the ground control workflow, let's look at the workflow without ground control. So as I said, the first step is that the end user will have to go and find a device that has enough battery. So hopefully somebody just kindly put that device on charge for them. When they have found a device with enough battery, they can then unlock that device with that same insecure password, that 1234. The next step here, step 2, they can open their whichever application they need to use. They need to recognize, are they potentially logged in as somebody else? If they are, they need to work out how to log out of that user. And then they need to manually type in their full username and their full password. So here on step 2, you can see that user is then typing in that username and password. So we'll just give it a couple of moments while that end user puts in their login information. Nearly there. Okay, so now the end user has logged into the application. That's fine. They can start using that application. And now what they need to do is that they need to remember, once they finish with that device, they need to remember, I need to log out of all the different applications I was using, and I need to charge ready for the next user. So what are the concerns here with this workflow? So the first concern is around, the end user having to go and find a device that has enough battery. The second concern is around that same insecure PIN, that 1234. And then the next concern is around, the time that it takes to actually get logged into those applications. You saw there, it took longer to log into that application. But where it really is a concern is if you're having to authenticate and log in multiple times during the day to that same application, especially, if you're using more than one application. And then the last concern there is around having to remember to actually log out of all those different applications that you were signed into. So now let's look at the ground control solution and workflow. So I know that you can see iPhones on the screen on step 1 there, but imagine that this device is plugged into a docking station. So this device is in a docking station, and the workflow is slightly different. So the devices all live in a docking station, and because the devices are in a docking station, they're being charged. And the way that somebody would check out a device is that a reader is attached to the docking station. So an end user will grab their proximity badge, they will tap it onto the reader. The ground control software will pick the healthiest device for the end user, so the device with the most battery, and then it will flash the screen white, clearly display the end user's name, so they know which device to take. So the end user taps their badge, ground control picks the device with the most battery. You can clearly see then which device to take. So Matthew needs to take this device. And then rather than having that 1, 2, 3, 4 pin, Matthew can now set his own pin. So he can put his own pin, which is unique for him, so that now if you lock this device, it's not going to have that insecure pin. It's going to have whatever pin that Matthew has set. Step 2, moving on to step 2 now, Matthew can now open whichever application he wants to. In this case, it's a Cosmos application. And the login process is a lot simpler, right? So here you tap passwords. We're now using autofill. So Matthew, it happened quite quickly there, but Matthew has tapped passwords. He's tapped the credential that he wants to use for the application that he has open. And now he's quickly logged in a matter of seconds. And then lastly, all Matthew has to do now is when he's now finished with that device, he just has to put that device back into the docking station, and then ground control, the ground control software will remove his identity from that device and depersonalize it, and also remove that pin that Matthew has set. So what that means is that when the device is then put back into the docking station and it's locked, we will then clear that passcode and then depersonalize it so that the next user that comes along can check that device out and it could be assigned to them. If somebody does take that device without tapping their badge, they won't actually be able to use that device because we put it into single app mode. They'll get this device's locked message and they won't actually be able to use it. So what are we actually solving here? So we're removing that insecure pin. We're locking the device when it's in the docking station. We're making sure that that device is charged. We're picking the device for the end user that has the most battery so that it's going to last the full shift. We're then providing those autofill capabilities. So the ease of access into that clinical application where it's a 3-tap process. You tap on the passwords button, you tap the credential you want to use, and then you tap the login button, which is a lot simpler than typing in that full username and password, especially if you've got more than one application. And then lastly, we're then removing that identity from that device when that device is plugged back into the docking station, and we're depersonalizing it, ready for the next user. And again, we have those reporting capabilities, so we know who was using a device and we know when they were using it. So moving on to the next slide here. Now, one of the questions you may have is, what happens if Matthew doesn't actually return his device? So what we do during that checkout process is that we will personalize that device to whoever has checked it out. In this case, it was Matthew. So on the lock screen, what we will do is we will change the lock screen so that it will clearly display the person's name who's checked the device out. We will also display the location of where they've checked that device out from. In this case, it's radiology. And then we will also display the serial number. The other great feature that we have with ground control is what's called overdue devices. So let's say Matthew's shift is 8 hours, and let's say we're expecting that device to come back after 10 hours. If it doesn't, what we can do is we can put a trigger event to say, let's put that device into loss mode because we're expecting it to come back. And then what we can also do is send a trigger event to, which is an email to an administrator to say, Matthew hasn't actually returned his device. We were expecting it to come back after 10 hours. It hasn't. You may want to check in with Matthew and find out, why he didn't return his device.
I think, James, if I may add on to that, as a nurse manager, this is a huge win for that asset tag tracing of these devices. Because without this capability of whether it is ground control or MDA, it's always me running around looking for those devices, making sure, please put your phone back. Where's your phone? and all of that conversation. So this really does take that angst and almost that annoyance away and put some accountability onto the end user and bringing those devices back, because those devices are expensive, and keeping them all in play is hugely beneficial, again, for those efficiencies and for those end users to be able to take care of their patients and what they came to work for.
Yeah, exactly. Thank you, Claire. So now moving on to what's new with our mobile solutions. So what you can see there is an image of the ground control admin page. So this is a dashboard that we've revamped now. So we have information that is available to administrator in a nicer view, so that they can clearly see within the tiles the health status of their launch pads, which are the docking stations. They can see the health status of their devices. They can see when their devices were last connected, how many are currently in use, how many are checked in, checked out, how many are in lost mode, etc. And it's a lot easier, that data snapshot there of giving that administrator clear visibility of the overall health of their launch pads and their dockings and their devices. Another great new feature is ground control now integrates with Microsoft Shared Device Mode. Now, what that means is when an end user checks out a device, we have a new button. Okay, so we have this blue button there, which, as you can see on the screen, which is sign into Microsoft. So an end user can now tap that sign into Microsoft button, and now they're redirected to their 365 page, and they can autofill their credentials. So they can use here autofill to pre-populate, to populate that password. And now, once they've populated that password and they're signed into the device, when they open Microsoft Teams, they're logged in straight away with the correct account. They don't see any login activities or prompts. They're logged straight into Teams, and they can start using that. When they've then finished with that device, all they need to do is plug that device back into the docking station, and then the ground control software will then lock that device, remove that user's identity from that phone, so that when the next user then comes along and taps their badge, they will then be logged in as the correct account. So the device is just locking there. So thank you for your time today. Thank you for listening to me and Claire and Andy. Back over to you, Andy, for some questions, potentially, if we have some.
Yeah, thanks, James. And yeah, just great to reiterate what's some fantastic new functionality coming there. I think a lot of it come from feedback from the healthcare organisations we work with, and about how we can improve the product to better reflect what they need at the front line. So really pleased to see that come along. Yeah, thank you everyone for joining. A minor apology that some of the speaker bios in the webinar interface might have been incorrect, but I can guarantee it was myself, James, and Claire that were presenting today. We do have other webinars that Peter and Martin are presenting, which you're free to check out on our website if you want to. If there are any questions from the live audience, please do pop them in the Q&A. If you're listening on demand, obviously we won't be able to do questions directly, but you can reach out and schedule a meeting with one of our team members in your region who'll be more than happy to address some of your more detailed questions about our mobile solutions. Plenty of resources on our website as well, white papers, data sheets, videos, everything you can need to help give you more information about how our mobile solutions can help you address some of those key challenges. Otherwise, it just then remains for me to say thank you very much for joining this webinar today. I hope you found it beneficial and enjoyed it. My thanks to James and to Claire. And yeah, have a great day.
Thank you.
Thank you, everyone.